in an era of COVID-19, there was a time when the only slogan was stay at home.
Yeah.
If it is to live with us forever, there are behaviors that have come in the family sector, in the nuclear family, which are very addictive and are hard to stop.
Many families are experiencing problem, and especially because of this addiction.
In the line of learning and developing themselves, they find out that they are in addiction, they can't control it.
There is phone addiction, internet addiction, food addiction. Instead of spending a lot of time doing something that is, you are not building yourself. It's a matter of prioritizing other things.
It was a great pleasure having you in our show today. Hello viewer, my name is Lucy Wanzakariuki. Welcome to our today's episode of Health Talk. This is where we empower, we educate, and we promote health. In our today's episode, we are discussing about sleep disorders. And with us in the house are special guests who are going to help us to understand what is sleep and the disorders that come along it. I am going to give them an opportunity to introduce themselves. Our Facebook page is GBS TV Africa. Our YouTube channel is GBS TV Africa. You can always subscribe and follow us. Welcome our guests. Let me start with the lady.
My name is Gladys Wanjiro. I'm a registered nurse at Kangondo Level 4 Hospital. Kangondo is in Machakos County, and I'm a mental health specialist.
Yeah, my name is Pastor Kesedi. I come from Machakos County, pastoring at a church called Kakuda Redeemed Gospel Church. Thank you, my viewer.
Thank you so much, our guests. We are going to understand first what sleep is. Many people face problems with sleep. Some people sleep for long, others short hours. But today we are here to understand first what is sleep. Pastor Kiseli, kindly guide us through what is sleep and its importance to a human person.
Thank you. Sleep is a naturally occurring state of the mind and the body, which is characterized by Halter state of consciousness, whereby you find that there is less movement of the body organs, and also the person while asleep is not conscious of the environment. And it is good because it is during the sleep when the body renews its strength. It is the time when the mind settles down. And during also that time, there is a lot of growth activities the body is undergoing through. So it is healthy for the body for one to sleep. So sleep is very important for the well-being of a person.
Thank you so much, Pastor. Now we understand that sleep is a period of rest. Gladys, this period of rest, how is it? What is for how many hours is a normal human person supposed to rest during this time of sleep?
Okay, thank you for that. During sleep, there are different, according to age and gender.
Yes.
We find that for kids, that is infants, 0 years to around 6 months, they have to sleep 14 hours. For adults, that is a normal adult of age,
yes,
the adult has to sleep between 8 hours to 9 hours. That is normal sleep for an adult. And we can break down to other ages, that is preschool, toddlers, but let's not go into those details. But let's say that for infants, they have to sleep 14 to 24 hours. For adults, it is 8 to 9 hours.
Okay.
Yes.
What are some of the things that can alter the normal sleep pattern?
Yeah, there are many things that can alter sleep patterns, and some of them are more scientific, but we'd like to go through, those are just naturally occurring.
Yes.
Like if somebody is experiencing stress, the mind is not settled. So instead of sleeping when one goes to bed, you find his mind is engaged, and as a result cannot find sleep.
Yes.
There are also people that are addicted to some behaviors, maybe drugs, or also drug addiction can also alter sleep patterns. Find that someone cannot relax because he's addicted to something.
Yes.
Instead of sleeping, the mind you find is busy, is engaged with other things. The other thing is also change of environment. If someone goes to a new environment, you may find that he's tensed. And because of being tensed, cannot get sleep easily. So there are many factors that can affect sleep patterns.
Okay. There are many reasons that can make you not to sleep well. Gladys, we are in the dispensation of COVID-19. Do these sleep disorders come along with some factors like political and all that? Yes.
During this era of COVID, of course, as Pastor had said, that there are many factors that influence sleep, and
Yes.
which now you're going to see on the page of sleep disorders. If your sleep is altered, you've said the normal sleep of a human being, we've already talked about that. So if your sleep is altered during those hours, especially in this time of COVID, anxiety being part of it, you're anxious, your body will not go to rest, your mind is not resting, because generally the mind, the hypothalamus, there's an organ in our brain that controls the activities of the brain.
Yes.
It is like the master in our brain. It's the one that controls all the organs that we have in our body. So during anxiety, the hypothalamus, the body senses that we are anxious. Instead of the body going into rest, it will produce hormones that will keep you alert. That's why when you're anxious about COVID, you don't know, maybe you've been exposed, you've been a contact, you don't know what will be the next thing. Now you're saying that there are political issues whereby people are anxious, maybe there'll be lockdown of counties, the business are going down. When you think about those things, your mind is alert, meaning that the normal process of sleep, your body will not be resting as it's supposed to be. And now you get the issues with the sleep disorders. When I talk about the sleep disorders, there are so many, but I'll major on 5 which are very common. 5 of them. Let me start the most common, which is insomnia.
Yes.
Insomnia, most of us experience it. It can happen without even any medical disorder or any abnormalities. Something that happens. This is whereby you're deprived of sleep. It's either when you go to bed, you cannot sleep the normal hours that you're supposed to sleep, or you wake up in between the sleeps. Yes. So that's what we call insomnia. Most people experience insomnia in different ways. For example, we have 2 types of insomnia. We have acute and chronic. In acute, I'll give an example. For example, you have a relationship issue. Maybe you're a married woman or a married woman. You have issues with your spouse. You've quarreled some few minutes before going to sleep. You'll find yourself that you'll not fall asleep the exact time you're supposed to be sleeping on normal days. If, for example, you fall asleep at 9, you'll find that between 9 to around 11, you're thinking about what has happened. Your mind is very busy trying to figure out what has happened, trying to come up with a solution of what has happened. Maybe you had loss of a loved one. Also is an example of an acute, a person who can experience an acute insomnia. For example, you've lost someone. During that period, you're always thinking about the memories are flashing, the activities that you used to do with that person. You find that the normal time that you're supposed to fall asleep, it is always disrupted due to that. But it's something that will not last for long. The second type is the chronic insomnia, whereby now the circadian rhythm has already been disrupted completely, and you cannot fall asleep for a very long period of time. You'll either find that you'll sleep for 2 hours. The second type of insomnia, we have sleep apnea, the one we call sleep apnea. This majorly, you can always find it in children. It's very normal in children, but not normal in adults. Sleep apnea is whereby you find that a person has fallen asleep and suddenly wakes up in between the sleeps. Majorly is caused by breathing pattern problems. Maybe if you have some illnesses like adenoids, tonsillectomy, you have a cough, dry throat, the sore throats. You'll find that during sleep at one point you'll have to wake up because of the irritation. Exactly. That's an example that falls under the sleep apnea. The other type of sleep disorder, you have something we call the leg rest syndrome. In this I mean, you find that your your limbs, they are continuously moving. They have a kind of a jerky movement. Yes, it's uncontrolled jerky movement. So during sleep, you find that those people, their limbs are continuously moving. So they fall under that category of rest leg syndrome. We have another one.
The legs moves until
Yes,
sleep.
exactly. It's like a continuous jerky movement of the leg. The other example is the other type of sleep disorder is the narcolepsy. Narcolepsy now falls under now the conditions that we said initially when we started, we said there are those sleep disorders that happen without any medical issues, but there are those that happen with medical issues. For the narcolepsy now, it falls under the medical issues because this is a person who falls asleep at any time, anywhere. The brain cannot control the amount of sleep or the time to sleep. So you find that in an interview like this one, I'm seated here, and then suddenly I go to sleep. You'll have to wake me up. That falls under narcolepsy. The last type of sleep disorder, it's called the REM dysfunction. That is rapid eye movement dysfunction. This is a condition whereby a person who is asleep and then suddenly they shout in their dreams. I don't know if you've ever had those kind of people. Their body is not fully paralyzed the way it's supposed to be. So they are moving, they are screaming, they are shouting, they are talking during their sleep. Also the sleepwalkers also fall under that category. Yeah, those are the types of sleep disorder.
Thank you so much, Gladys. This is very educative because I'm thinking of somebody who is dozing. There are people who doze even in meetings. There are people who doze even when you are speaking to them. Where does that one fall under?
The narcolepsy.
The narcolepsy.
Yes.
Anytime, anywhere.
Anywhere. The body cannot, the mind cannot control the time.
Yes.
Nor the place where you should fall asleep.
Yes.
So you just find yourself sleeping at any given point, at any given time.
Yes.
Can I add something there?
Yes.
In fact, it's also narcolepsy is also one of the major accident contributor. Somebody is driving and all of a sudden he falls to sleep and he can't control himself.
Okay. Thank you so much, Pastor. And to you again, Pastor. I'm just, yes, you're a psychologist, but many people come to you on the level of reverend, on the level of pastor, with so many complaints about sleep disorders. Do you see those people coming to you, and how do you approach it? Because we are really waiting to hear.
Yes, these cases are many. In fact, the narcolepsy situation, sleep disorder is common of late in school-going children, especially primary school. I've handled cases of such kind. Naturally, when these things happen, we associate with the demons. So we start casting out demons. But with this kind of understanding, we know that there are also other conditions that can affect, which needs medical attention besides casting out demons. So it's good to have this information. So these things are there. They are real. These sleep disorders. Somebody comes and tells you, I don't sleep when I go to bed. Other people, they say that they are very scared in dreams and they are scared when it comes to sleep time. They fear to sleep because they will have nightmares. Things like that. So they opt to stay awake. So I don't know where that one can be categorized, but it's a problem. So these things are there. So Gladys, can you take us through the signs and symptoms of sleep disorders so that as pastor is casting out the demon, he can also be having the know-how of the signs and symptoms?
Thank you very much. For the signs and symptoms of sleep disorders, we will just deprive from the types that we have said. Number one, there is poor sleep hygiene. In this I mean, you're supposed to sleep at 9 and you sleep at 11 due to other things you're doing in between there. Either you're watching a movie, you're doing other things. But even if you go to sleep before 11, you can't fall asleep. You're just rolling in bed, but you can't fall asleep. It shows you that you've already entered the stage of a disorder. Number two, there are people who, when they sleep, they only sleep for very less hours. That is less than 2 hours, and they are fully awake. They have closed their eyes, but their mind and their body is fully awake. That's another sign that you're entering the sleep disorders. Number three, you'll find that during the day you feel very tired. You have a lot of sleep because during the night your body didn't rest. because you said sleep helps up to rest. Now during the day you're very tired. The normal activities that you used to do, you are unable to perform the normal activities because you didn't rest during the night.
Yes.
That's another sign that now you're entering the line of sleep disorder. The fourth one is when you're sleeping, your creativity thinking improves because you've given your body time to rest. But now if you've not rested, you will not be creative enough. There are things that require critical thinking. You find that you're unable to think critically because your body has not rested. So you're also entering in the sleep disorder line. Yeah, thank you.
So you can also tell us that they have impaired judgment, impaired thinking, reasoning, memory. All these are going to be affected because of this kind of a disease.
Exactly.
Gladys, before I come back to you, Pastor will be telling, because the two of you now, people approach you with these problems. And I am sure before they come to you, they've done something. Before they go to Pastor, they've done something. Pastor, at what stage do they come to you? After medication or before medication? As Gladys also answers the same from the level of a clinician.
Okay, from a layman's language, people know that if you don't get sleep, you take a pill. I don't know whether it is
Piriton.
It's a Piriton, yeah, scientifically correct. Whether it is good medication, that's what people normally tell you. They have taken some medication. So they come when they have done something.
Yes.
Yeah, others who are strong in the faith, they tell you they have prayed and things have not worked.
Yes.
So they are coming to you for a higher intervention because they have tried whatever they knew how and it has not worked for them. Yes.
And after you have prayed for them, casted the demons, what do you do next to them?
After you have done that and nothing seems to have worked, when you listen what they have done, you have prayed and nothing seems to happen.
Yes.
Then there is the issue of counseling. You have to know something. You like myself, what I normally do, I interview this person. I ask them questions. What have you been life has been going through of late? I know whether this person has been doing something which is traumatic, something that is affecting, or he has undergone a traumatic experience, like Daktari was saying, losing a loved one. So that I may know why is this one happening? Because common and demon, we have casted out demon and it has not gone, and the problem is still there. So we inquire, we get an history of the life of this person.
Okay.
Then from there, I advise accordingly. Yes, I advise accordingly.
Okay, thank you so much. Gladys, if I may ask you, sometimes you meet people tiptoeing at night. Tiptoeing, you're walking slowly, and they're closing their eyes, or their eyes are open, but physically they don't seem awake. Is that a sleep disorder? As you also tell us, at what point do people come to you?
All right, thank you for that question. Now, there are stages of sleep.
Yes.
We have the random eye movement and non-random eye movement.
Yes.
In the random eye movement, you're sleeping, you've closed your eyes, but the eyes are moving around the eyeball. Your body has not fully gone into the slowing down of the system. Your heart is still beating very fast as the normal heart rate of 80 to 100. Your breathing pattern has not slowed down.
Yes.
So your body is not like paralyzed by that time. So that's the first stage of sleep.
Yes.
Now as you move from being alert to falling asleep to deep sleep, that's where the changes come in.
Yes.
You get to the first stage whereby there is a change between the being awakeful to sleep. Then the second stage from sleep to deep sleep, and then now the third stage where you are aroused. Now in the morning, because you always wake up without an alarm. So there's this thing in our brain that is called circadian rhythm. It's like a 24-hour clock in our system, because you cannot sleep the whole night and the whole day without waking up.
Gladys, if I may ask, how do you categorize sleepwalking? And how do you deal with it?
Sleepwalking is categorized under the sleep disorders. As earlier I had mentioned, it is under the type of random eye movement dysfunction, whereby your body is not asleep, but you've closed your eyes. There's the eyeball movement inside the eye socket. Your eyes are moving, but your body has not fully gone into sleep, whereby the body has not fully been paralyzed. So all the functioning of the body, because we said initially that sleep is controlled from the hypothalamus of the brain, which controls all the functions of the brain, of the body. So this person, all other functions of the body are functioning. You can move around, you can do this and that, but you've closed your eyes. So it falls under that sleep disorder.
So what you are trying to tell us is that sleep as a process. And when that process is altered, now that is when now we say we have a sleep disorder.
Exactly.
Okay, thank you so much for that explanation.
There are also activities that promote to having sleep disorders. Activities like exercising few minutes prior to going to bed. You've made your body very alert. You can't go automatically to sleep as you're supposed to do. That's why we advise the elderly generation that they should not have any exercise prior to going to sleep, because you see, for elderly people, they always have issues with sleep. You find that they sleep more during the day but have less sleep during the night. So as part of advising them and trying to retrain them back to retune the circadian rhythm, we advise them not to have activities like exercising. I find some people who exercise the weight losing management programs in late evening, a few minutes before going to bed. They have the notion that after exercising, your body will be tired, you'll fall asleep. But that's not the case. Your body is very alert by that time, just immediately after exercising. Going to sleep will take a long time than it's supposed to take. Another thing is the kind of beverages that we take prior to going to sleep, like caffeine. Caffeine, as we know, is a stimulant. So meaning that you stimulate your body. If you stimulate your body, everything goes up. Your heart rate, breathing, everything is alert. So falling asleep, there will be a problem. It will take some time before falling asleep. Yeah, thank you.
Okay, thank you so much for those risks. If I may ask, for the contributing factors, substance abuse, stress, can they really contribute? You talked of stress. What about substance abuse?
As I was saying earlier, we have drugs that are stimulants to the brain, and there are those that are depressants to the brain. They depress the brain. So substance and drug abuse, for example, you take something like a stimulant, a brain stimulant, a central nervous stimulant. It will stimulate your mind. Your body will not completely go to sleep because you will always be overstimulated. It's like you're overstimulating your body, your brain. The time that you're supposed to go to sleep, your body is already alert. It's the hormones that control fight, flight, and other activities. They are already alert. They are alert for the next course of action. Instead of that time, the body should be relaxing. You take those ones that we call the depressants. You find that if you overuse a depressant drug, for example, the one we give patients who have insomnia, we give a treatment called antidepressants, which they act to elevate a mood, and at the same time they help in sleep. They help to getting back the circadian rhythm to the way it's supposed to be. So if you overdose that the antidepressant, the depressants of the nervous system, you find that you will oversleep. A person is supposed to wake up at a certain time. This person oversleeps. You hear that there are people who sleep through the day, but if you ask them, they tell you there's something I took and I'm just drowsy the whole day. It's because that drug they took is a depressant. It is depressing the central nervous system. Your body is already asleep by that time.
You cannot be able to work.
Exactly.
Okay. Now, there are some risks associated with sleep disorders that can befall a person, a family, community. What are some of these risks, Pastor?
There are risks, like as you have said, issues of night walkers, which is more hereditary. It is from generation to generation. You find a certain community, they are that kind of a problem. Some people have been misunderstood to be witches, yet he's a night walker. He's just running at night. That's a risk because this person can get injured because of that sleep disorder. The other people also injure others when, as you were saying about muscle jacking. Somebody can knock somebody down, something like that, and they are asleep. So these sleep disorders, they are problem. They are problems. They cause problem to the society. Another thing, if somebody is sleeping, cannot think properly. If it's the time he is supposed to be sleeping, I mean, it should be awake, working. The person is asleep. So that will affect the society, because somebody is supposed to be working, yet he is asleep.
Yes.
He's sleeping during the day, because during the night he didn't sleep. So these are problems that can affect the community.
Yes, yes.
So there are problems.
Yes. Gladys, do you have another risk that you can add on what Pastor said?
Maybe just to add on the topic, for the narcolepsy, you find that this person can, as you had said, can just fall asleep anywhere, anytime. It's risky for the individual, because, for example, this person is operating machine and then suddenly falls asleep. It can cause injury to those people around the person or the person himself. Yeah.
Thank you so much, viewer. This is GBS TV Africa, and we are in Health Talk discussing about sleep disorders. We are educating you and we are promoting health. You can continue watching us in YouTube channel, which is GBS TV Africa. Follow us on Facebook page, which is GBS TV Africa, and we are going to continue after break. Stay tuned.
Coronavirus disease is now spreading within counties in Kenya, from person to person through contact with droplets when an uninfected person speaks, coughs or sneezes, or through touching contaminated surfaces and objects. Anybody with a weakened body immunity has a greater risk of contracting coronavirus disease. People living with pre-existing medical conditions such as HIV, cancer, TB, diabetes, among others, must adhere to their treatment to strengthen immunity, and therefore should ensure they have a constant supply of necessary medicines. Contact your clinic or health facility for information on how to access treatment. Help others within your network to access adequate supply of essential medicines. Ensure that you remain connected with your local networks for any support, and follow the medical guidelines provided by your health facility to prevent coronavirus. Remember to stay updated with information on coronavirus using only trusted, reliable channels. For more information on COVID-19, call 719 or dial *719#. COVID-19 is preventable. Protect yourself, your family, and the community. This message has been brought to you by the Government of Kenya and its partners.
Hello. Welcome to the GBS article, where entertainment meets enlightenment and creativity meets exposure. Join us on the most interactive art club in all of Africa. This is the Art Club with Ben C. See you there.
Echo Music right here on your #1 TV station, GBS TV. My good name is Hypolar the Experience. You can call me Moja Safi. Ukumazel, the best TV ever. Lafu shoni gani Echo Music SMS line 21144.
Tunakuchezea zile ngoma mpya zenye zimekuwa zikitokea hii wiki.
Anytime ulizia bila God nikulia na wakinikeuzia, I know you got me God, yeah you got me God.
Kautamu nikisa maneno nasikia kautamu.
Ati wanauliza gospel imedu bisa CMT we have to do. So Bible now we hand, so we physically, spiritually, lyrically, mentally.
Leo manze tuko na wasanii wa daily ndani ya nyumba. Tuko na muziki kali, tuko na countdown kali. Yaani kila kitu leo iko fresh. Chukua sharubati, hiyo ni juice hapo. Weka nguju ya meza.
Triple.
Yeah.
Tumia mtu salamu pale mali unakulanga chapo dondo.
Nani mimi? Walifunga.
Coronavirus disease is now spreading within counties in Kenya, from person to person through contact with droplets when an uninfected person speaks, coughs or sneezes, or through touching contaminated surfaces and objects. Anybody with a weakened body immunity has a greater risk of contracting coronavirus disease. People living with pre-existing medical conditions such as HIV, cancer, TB, diabetes among others must adhere to their treatment to strengthen immunity and therefore should ensure they have a constant supply of necessary medicines. Contact your clinic or health facility for information on how to access treatment. Help others within your network to access adequate supply of essential medicines. Ensure that you remain connected with your local networks for any support and follow the medical guidelines provided by your health facility to prevent coronavirus. Remember to stay updated with information on coronavirus using only trusted reliable channels. For more information on COVID-19, call 719 or dial *719#. COVID-19 is preventable. Protect yourself, your family, and the community. This message has been brought to you by the Government of Kenya and its partners.
Thank you for tuning in GBS TV Africa. We are in Health Talk and discussing about sleep disorders. We are live on Facebook page GBS TV Africa. You can follow us on YouTube channel GBS TV Africa. You can continue speaking to us on our SMS line, which is 21144. We are now doing the management of sleep disorders. And now I'm going to invite Gladys. Welcome.
Thank you. For the management of sleep disorder, we can approach it in two ways. We have the use of medication, that is I call pharmacological treatment. And there's the other way, which is the use of non-pharmacological treatment, that is use of non-medication. Let's start with the medication. There are a number of medication. I will not go into details because there are quite a number. But for all the disorders, and each type of disorder has its own specific type of management. When you come to our hospital, to our clinic, the first thing we do before we diagnose you with sleep disorder, we'll first have to rule out any other condition. With this, I mean, we'll have to do all the tests because you can be having other conditions that cause you not to sleep and not necessarily the sleep disorder. So we'll have to do all the tests. We'll send you to lab, we'll do investigations. After you have established now that you don't have any medical condition, it's purely the disorder, the sleep disorder now, that's where we focus our management on. That's where we focus our treatment. We give you medication that will help you. Most of the medication works towards retraining the circadian rhythm, calming down the stimulus, calming down the brain, so that during time of sleep, you're able to just go to sleep as a normal person should do. The other type of management is the non-pharmacological type, whereby we use different methods. We teach you on relaxation techniques. Example is like the massage. There's something called guided imagery. That is, you close your eyes, you think of a beautiful place. During that time, your mind is relaxing. And during the relaxation now, that's when your body can go into sleep. Your muscles will relax. Everything in your body will not be overstimulated. That's where we use the guided imagery. You can also do some massage. You can recommend massage, whereby you can even if you ask any person who has ever gone for a massage, during that process, most of them fall asleep because the body has relaxed completely. So you retrain the body to go back to sleep, and now you are able to fall asleep as the way a person should do it. So majorly those are the kind of things we do. There's another method that we use, that is reduction of stimulus. In this sense, we teach you on methods of avoiding the things to avoid prior to going to sleep. The one that I had said earlier, that is avoidance of things that will overstimulate your brain, which in turn overstimulate your body. The use of caffeine. I mean the coffee, the normal coffee you take, tea, those are stimulants. There are medications that will tell you to stop using them because they stimulate your brain. The exercise, the one that I had talked earlier, exercise. You don't exercise a few minutes to go into sleep. those are majorly those are the things that we normally advise our patients.
Yes.
That's the
You've
approach
talked
we take.
of guided imagery.
Yes.
You teach them from the hospital to practice at home, or there is somebody to guide even at home?
We always teach them to practice at home, but we also recommend them to a psychosocial. There are those people we call the psychosocial team, the psychologists. That's where they come in. Because when I tell you about guided imagery and just leave it at that point, I'm not sure if you're going to do it the right way. That's where the psychologists, they'll come in. They'll teach the patient how to do it, because it involves so many things, meditation. There are methods in which you will have to practice so that you may attain whatever he wants you to attain. That's where now the psychologist will come in. We refer we refer the patients to the psychologist so that they can pick up from there, from the non-pharmacological aspect of treatment.
Do we say that this is a method of distracting you from the cause of the sleep disorder?
Yeah, we can say that, though before we reach that point of disrupting, we'll have to know the main cause of the disorder.
Yes.
So once we treat the main cause of the disorder, the aftermath, we'll have to retrain you now to come back to the normal sleeping pattern. So during the retraining of the normal sleep pattern, that's where now we use those, either the pharmacological aspect or the non-pharmacological aspect.
Pastor talked of something. Before people come to him, they've already taken Piriton and maybe other Piriton-related drugs. What is your advice on Piriton?
Now, let me talk about the self-medication aspect of it. When we started the show, we had talked about the signs and symptoms of sleep disorder. We classified all the signs that a person can check and see that now I have a problem. We always advise our patient, that moment they have realized they have a problem, let them come to the hospital. Because self-medication, at times, you're not treating the cause, you're just masking. Because Piriton, I had talked about the stimulants drugs and the depressant drugs. Piriton falls under the depressant drugs. It will depress the central nervous system. You'll just become drowsy, but you've not treated the cause of the disorder. Because before you start having a disorder, there must be an interruption in the normal pathway. There's somewhere something has gone wrong. So when you come to us with those signs and symptoms, we'll establish exactly what disorder you have. Instead of masking with the Piriton, we will treat the exact disorder, then retrain you to coming back to the normal sleep pattern. So to our viewers, if you have an issue with sleep, it's better you come to the healthcare provider so that the healthcare provider can identify exactly what is wrong, where is the issue, where is the disorder, which type of disorder, give you treatment and retrain you, other than just taking any type of drug, self-medicating. You're just masking the problem. The problem is becoming bigger and bigger without it being treated.
Thank you so much, Gladys. We are learning a lot today, and we have known that over-counter drugs are not the best drugs for sleep disorders. There is more to just seeing your baby sleeping in class, sleeping anytime, your husband sleeping all the time. And now I come to you, Pastor. Psychotherapy. What is this people keep talking about psychotherapy, and how is it related to sleep disorders?
Yes, Madam, as even before I go there, I want to, something that I've remembered when we were talking about some of the causes of sleep disorder, and especially for children. It's good for parents to know that if a child doesn't perform well in school, that can also cause sleep disorder. And it is good for a child not to be harassed even when they don't perform very well, because that can affect their sleep patterns. Another thing that also on children, because this is a very important topic, when parents are not living or setting a peaceful environment, children can be traumatized. And when they go to sleep, they are scared, whether when they wake up, they will find mom, or when they wake up, they'll find that. So as a result, children are scared, and as a result of their sleep patterns can also get affected. So I remember that, and it's important to mention it now.
Thank you so much.
As I go to the issue, it's actually part of the psychotherapy, it's part of it, but I felt to specifically mention that. Now, when it comes to the issue of psychotherapy, this is whereby we try to look at the situation personally, when I'm doing that, I approach the problem from a spiritual point of view and also as a counselor. Because these things can also be demonic. So I have to give the person time to give me an history of what has been happening in his life or her life recently before this came to start happening, before he started having sleep disorders.
Yes.
So you listen to the person. And many times you find that there are things this person is struggling with. And one thing I've come to realize, many people think that they are who do not have problems. They think they are the only people that have problems. But I want to say that everybody has his own problems.
Yes.
But the issue is how you manage your problems. You cannot finish this world's problems. So the issue is focus at what I normally advise is a person to focus at one issue at a time. What you cannot change, leave it.
Yes.
Because if you carry a lot of baggage as you go to sleep, this will bring a lot of trouble. No wonder Jesus Christ said, "Come to me, O ye that are heavy laden, and I will give you rest."
Yes.
It's good to learn to lay aside some things. And for that, we also recommend also prayer is very important. When you pray, psychologically, you are satisfied that higher powers have taken your issues.
Yes.
So you can be able to relax. So that's part of it. Laying aside also, we also advise that somebody also to have somebody who is close, maybe a relative, whom you can also share your issues, empty your heart. What are your worries? What are your fears? Instead of recycling them in your mind when you go to sleep, so you find that your sleep patterns are affected. So it's a wide. Every situation we handle it specifically. Yes, specifically. Yeah, there are other sleep disorders which can come as a result of addictive behaviors. Somebody likes watching movie, so you are trained to watch a movie for very long hours at night. So even when you don't watch the movie, your body has been programmed to that kind of a thing. So
Like
we try to tell them to avoid. Yes. Yeah, even when there is no electricity,
you cannot sleep.
You cannot sleep. So we try to advise this person to avoid those things that stimulates them to waking up, staying awake for a long time.
Yes.
The other things are anxiety. There are things you want to achieve. Anxiety can also, we have had even people that when they are waiting exam, they can't sleep. That's why we advise people not to take the world on themselves.
Yes.
The world is so big, you cannot manage it alone. So that's what I can say about this of psychotherapy of treating somebody with sleep disorders.
Thank you so much, Pastor, because now you make us understand that before we even do anything, we have to recognize that there is a problem. We have to accept. And now, since psychotherapy is all about the mind, there must be a mindset that there is a problem and one is willing to come out of it. To Gladys, if I may ask, this treatment of sleep disorders, where can one get the treatment, the medication? Where is it available?
Oh, thank you for that. You can always go to any hospital, come to our clinics, can come to Kamundo Hospital, they're always there, or any hospital that has a specialist, and any healthcare provider. You go air out your issue, they will look at you and they will help you. Yeah.
Pastor, do you advocate for religious leaders to be educated or to be empowered on mental health issues or generally health issues?
Yes, it's very important because God is the one who has given us this wisdom. The medics, He has given them that wisdom to be able to handle these issues. And it's good for pastors to have this basic knowledge because not everything is demonic. Some of these problems, they are medical issues or things that need counseling and guidance. And as a result, we be able to help people. Not only just everything that comes prayer. Everything comes prayer. It is like what the Bible says, they treated my daughters superficially.
Yes.
Majuju hivi. Yeah. So what I'm saying is it's good for actually pastors to have this knowledge. It's very important. Yeah.
Where do you refer them?
It's good for a pastor to have a basic psychology and the counseling. knowledge, basic, even if it's just a certificate.
Yes.
It's very important.
Mm-hmm.
Yes, and they are there. You can go to the internet and Google. You can get many facilities that they train.
Mm-hmm.
They give basic, yeah.
Now that we understand sleep disorders are a problem in the community, in our church, in our society, Gladys, what is your message of hope for the people? What can you tell them now?
To my viewers, what I can say is that those conditions, they are manageable, they are treatable.
Mm-hmm.
The only thing is that most of us, we don't go to seek medical attention. We pre-medicate ourselves. We cover up the issue instead of just going to the hospital, getting help, and being healed of the condition. The best part about the sleep disorders, they are conditions that we can manage. The healthcare providers, they can manage. So what I can tell our viewers is that if you experience all the symptoms that we had said, all the issues that we have discussed, the best thing you can do to yourself is just check into a hospital, let the doctor examine you, let the healthcare provider identify the problem and give you treatment, and you'll resume your normal life as anyone else.
You mentioned something on sleep scheduling.
Exactly.
Can you elaborate on that? For somebody who is wondering, how can I schedule my sleep and why is it important anyway?
Thank you for that. Now, when you come to our facility with the sleep disorders, and as I had said, after we've established exactly which disorder is it, we've given you treatment, we've treated the cause. We have not rescheduled you back to sleep pattern, the normal sleep pattern. That is, we have to reschedule the circadian rhythm to work in the 24-hour clock the way it's supposed to work.
Yes.
With that, we teach you so many methods, including how to schedule your sleep. As Pastor had said, that there are those people who watch movie for long hours, then in that they will always interfere with their sleep pattern.
Yes.
So we'll start rescheduling you, telling you that, as we had said initially when we started the show, that there are these normal hours that a normal human being should sleep. So we will start by calculating the hours that you're supposed to sleep. They are 8 hours. 8 hours is from this time to this time. So we will make sure that during that time, you're in bed. As much as we'll go through the stages of sleep, the random eye movement, the non-random eye movement, until you go to deep sleep. Now, that's how we start scheduling you, the sleep pattern now. We'll take you to bed, you'll go to bed, you sleep, instead of doing activities in between. You're in bed, you're struggling to sleep, but with the time, you find that your body will just automatically, it's like it's conditioning. It's like conditioning the body now that at 8, I should be sleeping. So with the time, at 8, when you go to sleep, you just fall asleep without much of the struggle. That's how we start scheduling. It's like retraining you. I can say it's like retraining.
Gladys, I am sure there is somebody watching you and wondering, when you say from this time to this time, maybe from 8. Now, can you give me a range? Because I'm looking I want to imagine that I am the one suffering from that haltered sleep pattern. And now, with the scheduling technique, now I would like to learn. Okay. And I want to go home and practice. Can you now specifically give me time?
That's a hard question to answer. Because you see, people, due to different factors like work, family, you cannot say exactly that by 8 everyone should be asleep. There are those people by 8 they have not reached their homes. They are by 8 they are cooking. So we cannot exactly say there's a specific time that everyone should fall asleep. So
but
what you do,
count 8 hours.
Exactly. What you do, we look at your schedule. What you do at up to what time, what is now your resting time. From that point now, we'll count 8 hours from that point and help you now rescheduling that time. But I cannot say that exactly at 8, everyone at 8 I'll say that you'll sleep at 8 and by 8 you're still in traffic. That's not possible. So we will not say there's an exact time. What we say is that we always look at your schedule, the way your day-to-day activity runs, and then from that now we can re-establish how you're going to retrain your sleep pattern.
Yes.
Yeah.
Thank you so much, Gladys. I would like to go back to Pastor to ask this. Gladys has really outlined some of those techniques. For example, the sleep scheduling and categorically the relaxation technique. Have you had issues with your people, your followers, because now I've been given by Gladys to go and sleep. And here is a family. And the couple or the spouse wants now to sleep, to take advantage of sleep, relaxation as a way of dealing with their family issues. Does it happen? And now it has become a problem. The medical person, the doctor, wanted to help the person. And because of the way we live at home, at 9 on dot, I have to sleep. Whether it's a wife, the food is ready, not ready, the doctor said, it's my time to sleep.
That's a challenging question.
Yes.
Because each family has its own rules and regulations.
Yes.
But here it's also very good to create a good relationship. Because if it's a husband who is having the problem, or it's the wife that has been having the problem, then even the sleep pattern of the partner is also affected. Because if I'm awake, maybe I may start accessing internet. There are some mobile phones which make noise. So I will disturb you because I don't have sleep.
Yes.
So the best thing is it's good there be understanding that my spouse has problems, and then I have to assist. So there is that agreement. If it is at this particular time, then food must be cooked early so that this person can be allowed, and other activities that happen at night, so that this person can be allowed to have ample time to sleep, because it should be taken like a sickness, like any other sickness.
Yes.
Which needs to be treated.
Thank you.
The other thing that I can also add there is when she talked about watching views, going to maybe mountains, having a good pictures,
Imagery.
Like imagery.
Yes.
That actually is very important. We even encourage reading scriptures where Jesus, you visualize Jesus Christ having discussion with the Samaritan woman, things like that. You see those, somebody is coming to help, someone who is willing to assist, something like that.
Yes.
You see yourself, you visualize yourself listening to Jesus as you read the scriptures. I've heard people say that when I begin to read the Bible, I fall asleep.
Thank you.
Yeah, I fall asleep. Which is we may not understand, but from what he has said, I've realized it is calming the brain.
Yes.
Calming the brain, because it's like you are listening to God speak to you. So you are able to relax.
Thank you.
Fall to sleep.
Wow. Gladys, kindly give us your parting shot.
For my parting shot, I'd just like to tell my viewers that no matter what condition we have, the best we can do is just seek medical attention.
Yes.
Instead of sitting with your condition, being depressed, you don't know what to do, what to say, it interferes with your day-to-day activity, just go to a healthcare provider. There's always a solution for everything. Even if they'll not heal the condition completely, they'll always, there's something they'll do that will help you propel the next step. Yeah, that's what I can say.
Pastor, kindly give us your parting shot.
Yes, what I can say is to my viewer, in case someone may be facing this kind of problem of sleep disorder, is don't hide. You are not alone. Many people are undergoing through this problem. Share it out. Speak out. We even pastors, we are there also to assist you, to listen to your problem. And if you find it's more medical, then we can refer you to the hospital. If you find it's demonic, then we can pray with you. If it needs counseling, we'll counsel you.
Yes.
Yeah.
Thank you so much, our guests, for today. We were very glad to have you in the show. Thank you, viewer, for staying tuned to GBS TV Africa. This is Health Talk Show, where we empower, where we promote health, and we were able to discuss sleep disorders. And I am sure you now understand the importance of sleep. Every time, monitor your sleep pattern. If it is altered, kindly seek healthcare attention and also religious assistance from your religious leader. You can continue staying tuned in GBS TV Africa through our Facebook page and our YouTube channel. And thanks for today. Bye-bye.